Hi, my name's Abigail and I'm going to do a video explaining the EKG rhythm A-fib. So A-fib actually stands for atrial fibrillation. It is exactly what the name says. It's when your atria are quivering or fibbing in your heart. The atria are kind of shaking really fast at a rate between 300 and 600 beats per minute, but your ventricles are pumping normally. So how we're going to see A-fib on a EKG strip is you're going to have no P waves. So that's the first thing you're going to notice. We're going to basically have QRS complexes that are very irregular. The atria is going crazy. There's no way to count them. There's no way to see. There's no pattern. It's the only irregular EKG rhythm. And it's one of the most common arrhythmias you're going to see, just because it's common. This is kind of what it's gonna look like. It's a bad picture, but you're gonna have a lot of what we call these fib waves right here, and then you're gonna have irregular QRS complexes. So like I said, very irregular. It's very hard to count the ventricular rate. If you have a ventricular rate of under 100 beats per minute, it's called stable AFib. And then if you have a ventricular rate of above 100, then it's going to be unstable AFib. The second thing we're going to talk about is what kind of people might present or why we would have this EKG strip would be people who are post-surgery or have heart problems. You can have it in the elderly folks, or you can have it in people who are just have naturally not formed correct hearts, so just not a normal heart. And then the second thing we're also going to go over is how the patient might be presenting, or I'm sorry, the third thing. The patient might be presenting with heart palpitations, chest pain, dizziness, shortness of breath, confusion. So basically they would be looking with some altered mental status. You would also see a high or low blood pressure depending on if they are in shock or not. And if they are in stable AFib, which means they don't really have symptoms and they're not feeling too sick, you would just put them on a monitor and monitor them very closely when you take them to the hospital. If you have unstable AFib, then the first thing you're going to do is you're going to give the medication cardizem. Cardizem should work, but if it doesn't, you're going to give adenosine. If adenosine doesn't work, you're going to give amiodarone. If amiodarone doesn't work and your patient is very sick, then what you're going to do is you're going to synchronize cardiovert them, which is just sending a shock of electricity into the heart to see if you can correct that rhythm. It's definitely not as much as what would you do if you would defibrillate somebody, because that's what you do if the heart is in like VTAC, which is an unsurvivable rhythm. And hopefully that would work. Now, the problem we have with AFib and why we want to treat it is because if the atria are not pumping correctly, then they're not going to empty out. And if you don't empty out, then that blood is just going to pool there. And if the blood's pooling there, it can do one thing, it can clot. And if it clots, then that can lead to a stroke. So that's something we really do not want to see. It can also cause potential heart failure, and we don't want that either, because heart failure can be very dangerous. And if that happens, then the patient can actually die. So we want to treat AFib. AFib is not something that we want to continue to let happen. And yeah, so like I said, the condition is when the atria are fibbing and the ventricles are beating normally. There's actually a cool video on YouTube that if you go watch, you can see. It's called like the EKG dance. And like I said, the blood's not pumping effectively, and that can lead to multiple issues. What we're most worried about is causing a stroke, because the blood's going to clot right there, and if the blood clots, then we have a really big issue. All right, and that's all I have right now, and we'll see you later.